2020 regular but remote meeting of the Burlington Board of Health. It has now been 8 months that we have been meeting remotely. Burlington Board of Health member Libby Wallenjevitz will represent everyone in her reciting of the Pledge of Allegiance.
Thank you, Mr. Chairman. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, Libby.
You're welcome.
I am Ed Weiner, Chairman, and individually and remotely, we have board members, David McSweeney, who is our Vice Chair, Dr. Wayne Saltzman, Libby Wallenjevitz, and Mary Beth Welch. Also with us this evening is Susan Luminello, our Director of Public Health, Marlene Johnson, our Health Agent, Christine Mathis, Environmental Engineer, Sarah Kortemash, who is our Board of Health Administration Expert and IT Host, and Dawn Cathcart, Recording Secretary. Last, I want to thank the BCAT professionals who've worked so hard to make this program available to the public. We're still we're still operating in a declared state of emergency with special rules. Mr. McSweeney, our Vice Chair, will provide the legal requirements for tonight.
Thank you, Mr. Chairman. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 20, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Burlington Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to or view this meeting while in progress may do so by tuning into BCAT Government Cable Access Channel, the BCAT Government Meeting Facebook Live feed, or over the phone at 408-418-9388, meeting number 173-059-7297. That's phone number 408-418-9388, meeting number 173-059-7297. We will also be monitoring the comments on Facebook Live to see if there's any that the board may wish to address. And as a reminder to the board that all votes are required to be done by roll call for virtual meetings. And with that, I'll return it back over to you.
Thank you, Mr. McSweeney. Again, please note we are live on BCAT and Facebook for your comments and questions through this video technology. Everyone, as I have said in the past, remote meetings, and especially chairing remote meetings, are not easy. Preparation is many times that of an in-person meeting. Please understand, in this pandemic, we're doing the best we can. We have minutes from September the 22nd. Are there any omissions, corrections, or additions? If not, is there a motion to approve?
Move to
I have a motion by Dr.
Second.
I have a second by Mr. McSweeney.
Mr. Chairman,
Yes,
I have a correction, I think.
please.
Under school reopening updates in the second paragraph, Mr. Larkin stated that the biggest challenge is to stick to the strict checklist that if a student is feeling well, to keep them home. I think that should be unwell.
Thank you.
Thank you for
Thank you
that catch.
Yes, thank you for that catch. That
Okay.
would have been beautiful. Thank you. Are there any other omissions, corrections, or additions? If not, I will, I have a motion for the corrected minutes. Is that okay, Dr. Saltzman?
yes.
Then we will vote. David McSweeney,
Aye.
Dr. Wayne Saltzman, Libby Wallenjevitz,
Aye.
Mary Beth Welch,
Aye.
and I vote aye. That's 5-0. Thank you so much. citizens' time. Is there anybody on here, Sarah, that would like to address this board that are not on the agenda?
None that I can see at this time.
I'll just, for those people who may be on a telephone, if so, please chime in. Hearing done, none, we'll move on. I would like, our board is in daily communication and is closely working with the Burlington Public Schools. Tonight, we have Mr. Patrick Larkin, the Assistant Superintendent of Schools, who, by the way, is doing a terrific job, and thank you so much, to provide an update. Can I have a motion to take the update from the Burlington Schools out of order? There's a school committee meeting this evening, and he needs to get to that meeting also.
So
So
moved.
moved. Second.
So I guess it was Dr. Saltzman, second by Mr. McSweeney. All in favor. David,
Aye.
Wayne,
Aye.
Libby,
Aye.
and Mary Beth,
Aye.
and I vote aye. Thank you so much. Mr. Larkin, there are no new cases of COVID in our schools last week or this week, at least
correct.
this morning. Can you please provide us with an update, and then our board would like to ask you some questions.
Sure, I'm happy to. Thank you, Dr. Weiner, and thank you to the members of the Board of Health for letting me move up in the agenda so I can attend my other meeting tonight. Again, as I said last time, just great thanks to Susan Luminello for her support on a daily basis. We usually speak at least once a day. Fortunately, it hasn't been multiple times a day, I don't think, in the last week or so because we haven't had any new cases. The last time we had to notify the community of a case within the schools was October 1st. So we're happy and we hope we can keep that string moving along. Again, I credit the support of the Board of Health with our guidelines that we're using in the schools, our school nurses, and really all of our staff and families for embracing the checklist and not sending kids to school if they're not feeling well. Likewise, if there's a student that may have a symptom, parents have been very responsive about the fact that your child may have a headache and a runny nose. We need you to come get them now and get them tested. So I know it's a major inconvenience for the community, but it really has been a community effort to keep our kids safe and to make sure that we're not having this virus spread within the schools at this point. So I just want to give kudos to the entire community for their support and in embracing the standards to keep everybody safe.
Thank you very much. I know that people have commented, if they are not watching live, they will be watching later on Facebook. It's always posted. So thank you very much for this. Do we have any questions for Mr. Larkin?
Mr. Chair, I have one if you don't mind.
Please.
Yeah, and Mr. Larkin, thanks for attending and coming. I know it's time out of your personal life, and I appreciate you appeasing the board and coming here the last two meetings. It's been great, and the support's been tremendous. So thank you. I guess so. Two things. It sounds like, I'm happy to hear. And although we're very early on into the school year, it sounds like maybe the plan that we've rolled out, or you have rolled out into the school, seems to be working, because as things come up, we're altering and following the plans and the guidelines. And for the most part, although aside from a couple of cases, and I don't want to get into specific numbers, but a handful of cases, it seems like it's for the most part working as intended. And when we do have an issue, it seems like we're reacting according to the plan, and things are happening. So kudos to you and the team for that, and thanks for your hard work around that. The only question I would have is, the last time you were here at our meeting, I think the one kind of trailing piece was around the busing and school buses. And can you talk through, what we've done since, a couple of weeks, or I guess it's been a month now, since we've gotten together, and some of the things that have worked well and maybe that we're doing there?
Sure. Our Director of Operations, Bob Kuna, and his staff have, and Susan's given us some support as well, trying to encourage the bus company to kind of be a little bit more organized with the way they're going about keeping track of who's on the bus, where they're sitting on the bus. So as of the end of last week, we have confirmed the lists of who's on the bus, and we've assigned seats to each student. So one of the problems we had previously, we had to call some students close contacts on buses because we weren't 100% sure of exactly where they were sitting in reference to somebody that became a positive case. So now we can do a better job of contact tracing and not have students that would not be a close contact have to be considered a close contact. So that's, again, the support of Susan with encouraging the bus company to kind of get their things in order, and also Bob Kuna's office for really spending a lot of time to make sure that students were assigned specific seats and that the bus lists are accurate.
Thank you.
Great, thanks.
Are there any other questions? If not, I have a couple. First, Mr. Larkin, what have we learned? What have we learned from 4 or 5 weeks now again being back at school? What are we doing better, and what have we learned about having school in a pandemic?
Well, I think one thing we learned early on is we were fighting that balance of not alarming people and trying to be transparent, and it's hard to do both simultaneously. So I think the first case we had in one of the schools, we only sent a letter to the classroom, and we didn't necessarily send one to the whole school community, and we got a lot of feedback that we were withholding information, and we tried to just let people know that we're impacted by the positive case. But after that initial case and the community feedback, again, we're not trying to hide anything. We know we live in a small town. We know that, or we work in a small town. We know how social media works. So maybe we're a little naive in going about it that way. But from the second case on, and you can, like the letters that go to the website, if we have a case in any school, we're notifying the entire school community. Everybody in the Burlington Public Schools community that's connected is getting notification that we have another positive case, just to let people know, because we're trying to be transparent. There's nothing to hide. And again, the one thing we are struggling with, like if it could be an individual staff member or a student, is not to give away too much personal identifying information or any personal identifying information, because again, that's their right. Not to have that information shared. So we're trying to share it more broadly. For instance, this is not true, but I think the last case we had was a memorial 4th grade. So we let everybody in the district know we had a positive case in a memorial 4th grade classroom. I called all of the families individually in that classroom to talk them through the scenario, and everybody else just got the broad letter to let them know that there was a case at Memorial School in the 4th grade. We didn't give away the teacher's name or anything else. I personally called each of those families so I could answer their questions if they had any.
Thank you. And a second question that I get a lot: what programs are you working on? This isn't going to go away. What can we do, or what are you doing to safely bring back programs that we did pre-COVID?
Well, I'm happy to report that sports has started up at the high school, so that's come back. And I did talk to Sean Hart, our athletic director, today. And throughout the Middlesex League, sports have been happening for just over a week now, and there's no positive cases of, based on our athletic competition. And one of the things that we've done to try to kind of keep tabs on thing, and I guess you could call it kind of a cohort model, but say Burlington's playing Woburn in soccer. We will play Woburn on a home and away series on the weekend. So we'll play them one weekend, we'll go to Woburn. The next weekend, we'll come to Burlington. They'll come to Burlington. And what that does is it allows us, if there were a case of a positive test, we're only impacting 2 groups of athletes. We're not playing Woburn today, Wilmington next week, or 3 days later. We're really trying to limit. We're happy to be playing sports, but we're trying to do so thoughtfully. So if there were a positive case, we could take the appropriate actions. I know we're also talking about trying to get our instrumental music program back, and that will be obviously remote. These teachers won't be in the same room. With woodwind instruments, they'll be doing those types of lessons remotely. So those are a couple of examples of things that we're trying to bring back now that we're up and running.
Thank you so much. Are there any other questions for our Assistant Superintendents of Schools? From anybody on the phone or anybody from our audience? Well, I guess you answered all the questions. So thank you so much, Mr. Larkin. We appreciate you coming on. And I'll give you a preview. We're going to ask you to come back on our first meeting in November.
Happy
Thank
to be back. No, thank you. And thank you to the Board of Health for all your support, particularly Susan on the day-to-day basis. I know how hard she's working. And even though our cases in the school aren't up, I know that the town is a different story. And I know how hard she's working on that as well.
Thank you. I appreciate the call this morning. We also speak often. I appreciate it. Have a great day and my best to the school committee.
Thank you.
Okay, moving along. Chairman's report. So it's Chairman's report. Last meeting I said we're getting there, but things are changing. We are clearly in a viral upsurge. We're now in the yellow of our state COVID map. It may or may not change tomorrow. We cannot get complacent. The Board of Health must continue to do the many roles that we have to focus. We have to work to keep our town safe. That includes beginning to prepare for the seasonal flu, another virus that sickens and kills so many each year. We will have a flu clinic this Saturday. This board is one of the most busiest in not only this town, but in the region. I'm announcing tonight, in consultation with our director, the new normal is dictating that we need more resources. We need more personnel, possibly an assistant director and a part-time nurse. We have posted, as many of you, as all of you know, a part-time nurse position. We will discuss these issues at our next meeting in detail. We continue to face many never-seen challenges. The Board of Health has met these challenges, but we need to keep up as things continue to change. That's my report. If any questions on the report, please let me know.
Mr. Chairman, just a quick comment, not necessarily a question. I think, so thanks for taking the leadership of that. I do think it's the right thing to do. As you stated, this is the new norm. And I think we would be doing a disservice to the community if we weren't preparing ourselves for potentially a surge in the virus again. And you're right, this is also flu season. So appreciate the efforts there. I'm fully supportive of the new roles. And again, if there is a surge and we didn't do anything, I think we would be fools. So I think we're doing the right things and looking forward to a fuller discussion, a much broader discussion at the next meeting. But I appreciate the leadership there.
Thank you. Any other questions? If not, we can go on to the subcommittee reports. Are there any subcommittee reports? Dr. Salzman, do you have one? No, we do not. Okay. Right now, we will go to a variance request, and that will be presented by our health agent. I ask that she present what's going on. It's a variance for the variance for the installation of an external grease interceptor. Is that correct?
That is correct. So Mr. Chinwala is here tonight, and he currently owns a restaurant in Burlington, Almeida at 184 Cambridge Street. It's an Indian restaurant. So he is looking to open another restaurant located at 195 Cambridge Street, which was formerly the Burlington Cold Cut Center. And so this establishment is going to be more like sandwich and quick meals, not sit-down meals like at his Almeida restaurant. And the location does not have an existing external grease interceptor, and he doesn't own the property in which the location is located. So he is requesting a variance from Section 4, Part A of the external grease interceptor regulations. And I did include his application and also his menu. And just to let you know as well, his restaurant, we haven't had any issues with his grease interceptor. He always has that serviced on a regular basis. No problems with his restaurant in general. So he's a good manager at his restaurant. So my recommendation to the board is to vote to approve the variance from Section 4, Part A, and allow the new food service establishment to operate without installing an external grease interceptor with the following condition. The food service establishment operator and the property owner, who I did inform as well, and invited him to come to the meeting if he wanted to. Both understand that this variance may be subject to revocation, suspension, or expiration as determined by the Board of Health. A variance under these regulations may be revoked, modified, or suspended only after the food service establishment has been notified in writing and given an opportunity to be heard at a regularly scheduled meeting of the Board of Health. Reasons for revocation, modification, or suspension of a variance include, but are not limited to, a determination that the food service establishment is discharging grease in quantities sufficient to cause sanitary sewer line blockages or increased maintenance of sewer lines.
Thank you very much. Does anybody have any questions for Mr. Jinwala?
Hi, everyone.
Hi, how are you? We're very
Good, how are you,
excited
sir?
about a halal restaurant in this community. Thank you.
Sure. Thank you, sir.
Dr. Saltzman, Dr. Wayne Saltzman has a question or comment.
Sure.
Mr. Jamal, very much enjoy Almada. You really do run a good show over there. Very friendly, very good food. I do have a question about Halal Shack.
Yeah.
I just want to make sure are just given the name, are all of your meats going to be prepared as per Muslim law?
Yes, that's what I'm doing exactly with Al Maida too. So all of our meat is hand slaughtered, and I get it from the only the USDA certified products. So I've been doing that for the last 2 years as well from here. Yep.
Okay.
And it'll be the same products that I'll be using there.
Great. Thank you.
Yeah. Thank you, sir.
Are there any other questions? There are not. So I will, but don't go away. Don't go, Mr.
Yeah,
Mr.
sure.
We have a couple things to talk to you about afterwards. Do I have a motion to approve the variance as stated by the health agent?
So moved.
Second.
Libby Wallenjevitz, and second by Dr. Saltzman. We will put that to a vote if there are no other questions, comments. David McSweeney,
Aye.
Dr. Wayne Saltzman,
Aye.
Libby Wallenjevitz,
Aye.
Mary Beth Welch,
Aye.
and I vote aye. That's 5-0, 5-0. You have the variance, Mr. Jinwala. But you are a new restaurant in town. Tell us when you're going to open and give us an idea exactly what's on the menu. This is a free commercial that we do for everybody.
Sure. Yeah. So hopefully we'll be ready to file for a building permit this week. And as soon as we have that, we'll probably start planning construction, and then hopefully within by December, end of December, early January, we're ready to open. And the menu I'm proposing, it's like a New York cart style food. It's basically chicken over rice and gyros, like about sandwiches. So, and we don't have that many options in Burlington area. There's a lot of the steakhouses, but there's no like quick meal or sandwiches. So that's what I'm bringing into the town.
Thank you. Inshallah.
Inshallah. Thank you, sir.
Inshallah.
Inshallah.
We wish you well, and I'm going to try it. So thank you
Definitely,
so
sir.
much.
Yeah, I'll be
Thank you
happy
so
to
much.
host you. Thank you very much, sir.
Thank you. Take care.
Thank you.
Thanks.
Take care. Bye-bye.
Thanks for coming.
Sure. Thank you, sir. Bye-bye.
We are at staff reports. Uh, the environmental engineer is Christine Mathis on.
Hi, yes, I'm here. Good evening,
Please, can you give
everyone.
us a brief summary?
Sure. So I'll give you a mosquito update in that the trapping and testing of mosquitoes has been completed for the season by the state. Burlington remained at low and remote for Tripoli and West Nile virus risk levels. I would just remind everybody that mosquitoes are still around, and they'll stay around until the first hard frost, which is 4 hours below 28 degrees. So I don't think, we're not there yet, but we're getting close. One less thing to worry about. And just a quick update on the project at 101 Middlesex Turnpike. That's Vinebrook Plaza, that with that reoccurring large puddle. They have gone out to bid for cleaning out of the sediment from the basins and the drainage system. And they are in the process of applying for a permit from the Natural Heritage and Endangered Species Program of the Division of Fisheries and Wildlife, because there's a small fish that is an endangered species that is in that part of Vine Brook, and they need to get a permit to move those before to catch, hold, and reload and put them back in while they do the dredging.
Thank you.
You're
Are there any questions for our environmental engineer?
Mr. Chairman.
Yes, please,
Hi.
Mary Beth.
Hi, Christine. I just had a quick question. I was looking under your investigations, and one of them was a case of Legionella. I'm probably not saying this right. Legionella pneumonia. Is that I haven't seen that before on your report, or is that something common or rare? Like, what? Could you explain that a little bit?
Sure. So no, it's not common. I worked on it with Chris Pollock, our nurse.
Okay.
She was, of course, made aware of it via Maven, and it was a out-of-town individual who would come to the location listed for a lab appointment. And I just worked with the establishment to make sure that they hadn't had any other cases reported to them. And in fact, they hadn't. So the conclusion that we came to was that she got the exposure someplace else, not at that location.
Thank you.
Yeah, Legionella pneumonia is also called Legionnaire's disease. It was that outbreak that we may remember from many, many years ago at a convention via bacteria through an air conditioning unit. So it is atypical. It is not. It is not. It is not common at all. And but it does exist, and when people do present to the hospital, they are checked just to make sure, and there's a special test to make sure they don't have Legionella pneumonia.
Thanks, Christine. Thank you, Mr. Saltzman. Thank you.
Are there any other questions for our environmental engineer? If none, I have one. I've received calls around the Burlington hockey and skating at the Ice Palace. Um, have you had any complaints? Uh, and is that what you were looking at in your report?
I had one inquiry that came in regarding the hockey playing over there, and it was less of a complaint, more of a looking for assistance in understanding the guidance documents from the state. So I just walked through the guidance with the particular person that was interested and made some clarification, help them understand the standards.
And basically, those standards are maybe a couple of them, the main ones.
So players have to wear masks when they're on the bench or closely grouped, but they're allowed to take their mask down when they're doing aerobic activity, such as like sprinting the length of the ice, something like that. Coaches, referees have to wear masks at all times. The close contact aspects of the sport are discouraged. So they're not supposed to, fight at the boards to get a puck. They do have to wear a mask when they do a face-off. They're encouraged to participate in cohorts, as was explained by Mr. Larkin about, the soccer games. And the standards are lengthy, but off the top of my head, that's what I can think of right now.
Thank you. That's great.
Okay.
No other questions? Last call. Could I have a motion, please, for the approval of the environmental engineers report?
I'll
So
make a
moved.
motion.
Oh, sorry, go ahead.
I'll make a
Mary
motion.
Beth,
I'll make a motion to approve the environmental
and now,
engineers report.
David.
Second. Or
A motion, a second. Any other questions, comments? If not, I'll put it to a vote. David McSweeney,
aye.
Dr. Wayne Saltzman,
Aye.
Libby Wallen-Jevitz,
Aye.
Mary Beth Welch,
Aye.
and I vote aye 5-0. Thank you so much. Our next is the health agents report. We are privileged today to have Marlene Johnson. Just one comment. Our public health nurse is away on family leave and she is out of town and will be for a bit. I'm not sure how long, but everybody else is pitching in to help out. Marlene, please, would you please give us a brief update?
Certainly. So I've been updating the food service establishments with the COVID-19 safety standards. Every so often, the state has added some reopening or some allowances, such as the seating at the bar is now allowed as long as social distancing is adhered to. As far as retail stores, so your Quick Marts and the retail stores and the gas stations, they're allowed now to offer self-service for coffee. Again, they have to follow the safety standards that are outlined for that. And Samantha and I both have been getting the routine inspections completed. So we're chipping away at that. And then right now we're going through the food permit renewal. So we have a lot of applications coming into the office and a lot of phone calls regarding that and some time limits for those to come in. So that's what we're working on here.
Assistant health agents report. Came out to us today. If everybody has read them, we can include that in your report also. So would you like me to hold that report, or have you all read it?
I'm sorry, which report, Mr. Chair?
We received Samantha's report today also late in the afternoon from Sarah. Why don't we hold that? We'll hold that to our next meeting. There was nothing earth-shattering on it, but we'll hold that for next meeting. Do we have any questions for our health agent?
Mr. Chair, may I?
Sure, please.
Hi, Marlene. So I've noted that a couple times a week you get calls regarding folks not wearing masks. And it appears that the establishments are being very cooperative and are really promoting good citizenship and as we would expect from institutions in our town. But any concerns about frequency or any other pushback or concerns in general from trying to stay in line with COVID mitigation tasks?
I haven't experienced that at all. Everybody's been great, and they've been trying as much as possible. And every once in a while, a customer will come in, or an employee will have a mask fob all over the nose, and so they're trying to stay on top of it, but no pushback. Everybody's been very cooperative.
Great, thank you.
Mr. Chairman,
Yes, please.
Marlene, what's going on Ray Avenue? Is there an update?
In regards to what?
To the Cafe Escadrille and the grease.
Oh, I think Susan was working on that one.
Oh, okay. All right.
Thank
I'll
you.
ask her.
Okay.
Are there any other questions? I had just one, and that has to do with the question you received about the live processing of poultry. And is that moving ahead, or is that, I realize they need a state permit for that, but what's going on with that?
I haven't seen any plans come through, so until I get something in black and white, I'll let you know.
Thank you.
You're welcome.
As a kid growing up in an ethnic community, there were a number of those types of butcher shops, and I haven't seen anything of that for a very long time. Please keep us up to date.
I will.
Anybody else? Sarah, we're going to please add the assistant health agents report to our next meeting. Thank you so much. Do I have a motion to approve the health agents report?
So moved.
Thank you, Dr. Saltzman. You have a second?
Second.
A second by Livy Wallenjevitz. All in favor? David McSweeney,
Aye.
Wayne Saltzman,
Aye.
Libby Wallenjevitz,
Aye.
Mary Beth Welch,
Aye.
and I vote aye. That's 5-0. Thank you so much for coming. It's a pleasure to have you. Our last is Director of Public Health, and lots of stuff's going on. And I can tell you, I don't think there's anybody busier in Burlington than Susan Luminello. And we're very lucky. You know, the Department of Public Health in the state is offering many professionals counseling because they're so overwhelmed. We're so lucky to have somebody, Susan, who handles everything so beautifully. So, Susan, would you please give us a brief update and please mention the endeavor going on this Saturday?
Yes, thank you. And I think a lot of that credit also goes to our staff as well, because everybody is just kind of, they're all working, they all know what their areas are. Everybody's kind of taken up a COVID area and works on those as we go along. And it's just been, I think we're all working great together as well, and we're getting things done. So even though, like, even at this time when we're short-staffed and we have a big event coming up, we're able to get things done efficiently. So it's great, and I appreciate all the staff and everything that they do. So this Saturday is a big drive-through emergency dispensing site. 10 to 1 p.m. We're going to be dispensing flu vaccine. We have it for adults and children. We do not have any high dose available. We have done high dose clinics already in the office, and we're going to be completing that when the nurse returns. So we now have 10 dispensers on each line. So we have 2 lines, and we're going to have 2 teams of 5 dispensers in each line. Each team is going to have dispensers that can do adults and children. And we will have behavioral health people on with each one of those teams to ensure that the dispensing to children goes smoothly. So we are pretty much all set with that now. We're going to have over, I think it's about 50 volunteers who are going to be helping us out in each of the areas. I think you've all seen the map. So if anybody has any questions on that, I wanted to give an update on how much vaccine we have. So right now we have 280 doses of the state supplied vaccine. That's for children ages 6 months to 18 years. And we have 430 of the private purchase vaccine. Currently now, we're expecting another 100 doses this week. So in total, we're going to have 810 doses available for Saturday.
And how does that compare? How does that compare to prior years, Susan? And thank you for the update on that.
That's more than prior years. So we did get more of the state supplied for children this year. We got 100 additional doses than we expected to get, mainly due to the fact that the expectation is that we're going to have more families coming through with children because it is a requirement for school this year.
This is an emergency drill, as we have done in the past. And is this a rehearsal for COVID?
If we had to give out COVID vaccine, this is the plan. So yes, this is the plan that we have now in place. That's why we're attempting to do the drive-through. We wanted to practice for COVID because the drive-through option seems to be the best option to vaccinate a lot of people in a short period of time.
And have any other communities done this, or are we the first?
No, other communities are doing it. We are not the first. I think that I haven't heard anything about how other communities' drive-through clinics have gone, but we are definitely not the first. A lot of communities are doing it by appointment. So we have opted not to do it that way. But they're either doing it, I'm not sure how many other communities have done it without an appointment-based system.
Thank you. Are there any other questions for our Director of Public Health?
Libby had the Ray Ave question. So just on that, we haven't had any issues there with any kind of sewer backups. I don't know how often the cleaning is going from the DPW. I can check with him to see if they have kept to the same schedule or not. I'm imagining that he hasn't dropped down his cleaning schedule, but I can find out for you for the next
Thank
meeting.
you. Are there any other questions?
Just one quick question, Mr. Chair. So, Susan, are we, and certainly I don't believe this is in our purview anyway, but is the town giving any guidance to Halloween this year for kids, and are we involved in that at all?
So we have information on our website for Halloween that some information that's come from CDC and DPH, and also some infographics based on that. There is no, the state hasn't come and said, we need to cancel Halloween. Basically, we need to do, if you want to choose to do Halloween, these are the safe ways that you can do it. And that's what the information on our website is about, how to avoid having parties, how to dispense candy in a safe way, what's considered low, medium, and higher risk, so people can take all that into account when they decide what they want to do for Halloween. So the state hasn't stepped up and made any decisions about, what is going to cancel Halloween or not. It's basically just saying, these are the guidelines, this is what we think people should be doing.
Thank you.
Susan, I This is Mary Beth. I just had, under your investigation and complaints too, I saw the cleaning of the playgrounds at schools. And was that an investigation or a complaint based on outside of the school hours? Or, because we know that playgrounds are used, not just during school hours. So if you could just explain a little bit of that.
Yeah, that came in from the schools.
Oh.
Someone at the schools wondering who was responsible for cleaning the playground equipment and how often it got cleaned. And that's the recreation department. So the recreation department, I did contact them, but they are cleaning, as much as they can, that equipment. And they put signs up at all of the playgrounds and the parks and everything. But yeah, that's their purview, and the recreation department has been, on top of all of these COVID guidelines. So I'm pretty confident in the way that they handle things that are their responsibility.
Great. Thanks for explaining that.
I hope we will see everybody at the flu clinic this Saturday. I know that many of you have told me that you will be there, but if you were questioning whether you can be useful or not, you can be, and I'm hoping that every board member can come. No other questions? I'll entertain a motion to approve the Director of Public Health report.
Motion to approve.
That's
Second.
Dr. Saltzman, second by David McSweeney. I'll put that to a vote if there are no other comments. David McSweeney,
Aye.
Dr. Saltzman,
Chief Medical Screener, aye.
Libby Wallenjevich,
Aye.
Mary Beth Welch,
Aye.
and what is the name of my role again, Director?
You're Public Information Officer.
Public Information Officer Ed Weiner votes yes. That's 5-0. Thank you so much. Is there any other discussion that anybody would like to bring forth? I know that David McSweeney and I are going to volunteered to work on the job description for an assistant director of public health. If you have any comments, please call David. He's available all the time. If you'd like to add something into that.
Mr. Chairman, I think I just heard that you're the Chief Information Officer, so.
Yes, but you're chair of this subcommittee. We're going to put together in conjunction with our Director of Public Health and for discussion for our next meeting. So thank you so much. If there's nothing else, I'll take a motion to adjourn.
Motion to adjourn.
Dr. Saltzman, second.
Second.
I have a second. David McSweeney. All in favor? David.
Aye.
Dr. Wayne.
Aye.
Libby.
Aye.
Mary Beth.
Aye.
I vote aye. Everybody. First, that's 5-0. Everybody stay safe. Be well. Dr. Saltzman, please.
Yeah, it's challenging times in front of us potentially, so please be the good citizens that you have been up to now and will continue. Hand washing, standard precautions at home, and social distancing and face masks. It's our world. Thanks, everybody.
Thank you. And with that, good night, everybody. Thank you all for coming. Good night.